Good morning, Dr. Lieberman. This is Julie Williamson. I'm 72 years old. I live in the Woodlands, Texas, just north of Houston, with my husband, Mike, and my dog, Zoe. I've been retired from teaching and coaching for almost 15 years now, I guess. But we were out here living the good life. I was pursuing all my interests. I love to bike. I like to hike and camp and walk around the national parks and just be outdoors. That's my thing. Unfortunately, with these back issues, the pain that I've been experiencing in the lumbar area, I have not been able to pursue those things. I am able to walk a little bit, maybe a quarter of a mile without pain, but I can't pursue the things that I want to do. It's very, very, very frustrating. So I was hoping that, based on YouTube videos that I've seen of yours, I was hoping that you might be willing to offer some advice to me as to which direction to go.
I have a sister, Julie, so you'll have to forgive me the fondness for the name.
Oh, well, that's good. You'll remember me then.
Yeah. When did you find out about the scoliosis, Julie? Did you know like as a girl, or is it just been as, no?
I grew up in North Arkansas in a very small town, and we had a county nurse, but there were no tests or anything, to discover that. So I've been many, many years. I think it was 20 when I got the second MRI, and the doctor told me that it twisted this way and then also the curve. So go ahead.
What kind of symptoms is this causing? Are you having back pain or leg pain or no pain? What hurts?
The back hurts continuously. Particularly right now, it's on the right side. Sometimes it's on the left. I think it has to do with how I'm using each side. And right now I have pain in my right glute. It goes down through my hip and toward the center of the quads. I can walk. I can't walk far. I maybe a quarter of a mile.
And then what happens? Is it pain in the back or pain in the legs that stops you?
Pain in the back stops me. I sit for a bit and I can resume, but when you do, you don't. That second time, you can't get nearly as far as you did the first time.
Mm-hmm.
Yeah, I have to stop more frequently.
I'd like to go on and look at your films with you, and then we'll talk about what's going on. You mentioned the scoliosis and some other unwanted critters. Let's talk about that, and then we'll talk about best practice for managing your condition. Is that okay?
Yes, sir.
This is a view through you from the front. So it's like we cut through you long ways.
Mm-hmm.
This is a kidney. This would be your other kidney. These are your hips, your pelvis down here. And your spine, here's a spinal bone. Your spine should be straight up and down like this, but the scoliosis is this curve right here. So that's the image of your scoliotic curve. And here's your L5, 4, 3. Yeah, your L3, 4 is what they would call the apex. 2, 3, 4 is the apex. It's where the curve comes to the turn and then goes the other way.
Uh-huh.
So that's your scoliosis. If we look at you from a perpendicular cut, so now we're sectioning through you. This is your sacrum, and in these cuts, this is your spinal canal here. So you happen to have an unusual condition called a Tarlov cyst here at the base of your sacrum, which I don't think is impacting you very much at the moment, thank goodness. But here's your spinal canal, and this is beautiful. and here's a facet joint, here's a facet joint, and this is great. There's no swelling in the facet joints, and your spinal canal is wide open. And then as we move up your spinal canal, here's a very swollen facet joint on the right, but not on the left. And then as we move up a little bit more, now instead of the spinal canal being that round area, now we're a triangle. In Texas, you probably call that a steer's head. That's a, I don't know what they call it in Arkansas, but that's stenosis. That's a picture of stenosis. It's going from the circle to the triangle, as that narrowing is stenosis. So, but also interestingly on the right is that joint issue. And then as we go further up from there, we've got a real pinch here. Here we're at the apex of the scoliosis, and we've got a real pinch on the nerve root that comes out there. And then as we go up higher, it starts to get a little better, again with the very swollen facet joint on the right. And then we keep going. Oh, I'm sorry, I'm going the wrong way. Then we keep going and we get to this lovely, which is back to the good stuff. Now we've got a nice open circular spinal canal and no narrowing, and everything looks terrific. So yeah, you've got degenerative lumbar scoliosis and spinal stenosis and an incidental appearing Tarlov cyst. And those are your main problems.
Okay. So that's why I hurt all the time.
You're entitled to your pain, young lady. You're more than entitled to your pain. I guess the big question for you is, are you over 50?
Yes, 72.
There's no fixing this at this point in your life. The surgery that would be required, most doctors would say if you're over 50, you're too old. Some would say if you're over 30, you're too old. And all of them would say if you're 72 years old and you have Parkinson's disease, which affects your ability to undergo long-term anesthesia, as you mentioned, and recover. So you're too experienced for repair, which doesn't work very well anyway. It's a horrible surgery. The recovery is ridiculous. It's a year of recovery. It's off the books. It's off the shelf for you.
Okay.
So it's important because it means we got to switch gears from thinking about how do we fix this to how do we live a successful and pain-free life with this. And that's true of everything, right? I mean, we don't have the hearts that we had when we were 17, but we don't go around saying, God, I guess never be, no matter how much I try, I'll never be an Olympic marathon runner. No, no, ma'am, and no, sir, I will not, and you will not. But like, that's the reality of aging. And so it's really not that big a deal. It's just something that we have to accept. This is where it gets hard with you. Because remember, the pain is mostly on the right, correct?
Yes.
There's two different conditions that this could represent that is the direct cause of the pain. And I guess there's three, because one would be it's those swollen facet joints on the right. Another would be it's the spinal stenosis and the pinched nerve roots. And then the third would be it's a combination of number one and number two. And it's really, really hard to sort this out based on when you have this many levels involved and what have you. It's very, very challenging to sort it out based on how it feels. And so usually this is where the best practice is to turn to injections, diagnostic injections, not therapeutic, but diagnostic injections, to try to understand exactly what's wrong. So if we were to do what's called, if you had a pain management doctor, do a medial branch block on the pain fibers that go to those swollen facet joints, that doesn't affect those pinched nerve roots. So if you had, and that block is going to last for maybe 3 or 4 hours, depending on the kind of numbing that they use. So if you had that medial branch block and you were pain-free for 4 hours, 100% pain-free, and then the pain came right back like it was before, that would mean that 100% of your pain was coming from those joints. And the treatment for that would be radiofrequency ablation. Have you had medial branch blocks? Have you had radiofrequency ablation?
No, no, I have not.
Okay, so that would be that would be step one in your care. Now, let's say you have those medial branch blocks, but the pain's relieved 40%. That means that 60% of that pain is coming from the narrowing, and then the doctor needs to figure out which level is the worst, block it, prove that's what's causing it, and then you can have a microsurgery to open that stenosis up a little bit to allow more room for your nerves to function. Now, that surgery is the opposite of everything I told you before. That can be done as an outpatient. That takes less than an hour. That takes a half-inch incision and is done through a tube. All of that kind of stuff is what you want, especially with the Parkinson's, because the recovery is minimal. What you need is a minimally invasive surgeon. And
Well, do you find those people?
well, you look on the internet and you call us. We can help you do the research. Let us do.
If you want in Magnolia, which is very close to me, Kosoff or something like that. It's
Okay, well, I'm going to ask Phoebe to talk to you, and she knows what to look for.
excellent.
She'll work with you, and we'll find you somebody good. If you'll agree to come back on and tell me how it goes.
Okay, sure.
All right, it's a
Thank
deal. It's a deal, Sister Julie. I can't wait to hear you back.
All right, thank you. I hope
Bye now.